Welcome to the Long-Term Care News channel, where we bring you the latest in long-term care news. Today, we look back at another year in the battle against skin infections. January. An elderly client with cancer who lives in a long-term care facility has a flare-up of shingles. A nurse's aide who has never had chickenpox contracts the virus and is out of work for 3 weeks. The client is hospitalized for 1 week. February. An outbreak of scabies is reported at a nursing home. The home is cited by the state for failing to provide for the basic needs of their clients, as the infestation was not treated. Multiple staff members are infected. A corrective action plan is put into place. March. 6 clients of a surgical rehabilitation center are hospitalized for fungal cellulitis infections. The outbreak is traced back to the acrylic nails of one of the nurses. The nurse loses her job and the facility pays all hospital costs for the clients. There is a media storm, and enrollments at the facility are down by 50%. April. A nurse's aide who has had a kidney transplant and takes immune-suppressing medications contracts warts on her hands from a client. Because her immune system is not strong, the warts grow out of control over her hands. She is forced out of work until her medical condition improves. May. A long-term care client with a long history of psoriasis contracts an aggressive skin infection on her right arm. After a long battle and related hospitalization, the decision is made to amputate the arm. June. A long-term care facility requests visitors not visit the facility due to a highly contagious infection. Family members report to the local news that the outbreak is a scabies infection. The facility is unavailable for comment. 11 new cases of scabies are reported to the health department from another long-term care facility. July. A homeless shelter is reported to have ignored a bedbug infestation at another local shelter. Numerous homeless clients were bitten by the bugs, and the bites become infected with MRSA. August. The same facility from February has a repeat scabies outbreak. This time, more than half of the clients are infected. Facility administrators think the outbreaks are related. September. A long-term care facility closes its doors to visitors for 24 hours to rid itself of a head lice infestation. The facility spends $10,000 for medicated shampoos, employee overtime, and cleaning services. All staff members and their families are medicated. October. 3 clients of a nursing home sustain pressure ulcers that become infected and require hospitalization. The hospital reports the nursing homes to the Department of Public Health for neglect. An inquiry is pending. November. A MRSA outbreak at a local chain of long-term care facilities is traced back to crowded conditions, poor hygiene of the clients, and an unclean environment. The victim's families cite the chain administrator and 3 employees in a class action lawsuit. December. A trained owl brought in for the holiday party at a local nursing home leaves behind more than just good cheer. A tiny scratch on the arm of a client results in an awful wound with a fungal infection. As an employee of a long-term care facility, your work can be physically and mentally exhausting. Your priorities are constantly shifting, and there is always more work to do. So how could this newsreel report such awful events, and who is to blame? How could we make the year in skin better for the next year? The answer is through education and prevention. We know you're busy and your time is valuable. So we've developed this course to give you a one-stop shop for information about what a skin infection looks like, what conditions contribute to skin infections, and how you can help prevent them with a few simple strategies. Let's get started.